So they have all different personalities, different needs,
Herding
different
cats
wants.
is the
Herding cat. Yeah,
thing to say.
how do you herd these cats?
Yeah, so almost always you're dealing with multiple providers. In a hospital setting, depending on what type of floor you're on, I currently work in a rehab inpatient unit. And so we have a little bit more stable staffing and we're in a training facility. So we work a lot with resident physicians. So yeah, there's always like multiple people usually have to contact, and that's not even counting like specialty care. Because again, the people that are in the hospital tend to have lots of things going on. So they may have their main doctor for this floor, and then they have maybe a neurologist, a cardiologist, a podiatrist, maybe in rehab, physical therapy, occupational therapy, rehab psych, da da da. So you have to manage. So again, back to like the perception of what nurses do, there is this perception that nurses just follow doctor's orders. That the doctor is the boss, and they are the one ultimately responsible. But as nurses, we have our own nursing license that we have to maintain, and we have standards of care and scope of practice that we have to follow within. And a lot of it is independent critical thinking that we have to do. And so, yes, a big part of our job is managing all the cats because they're all going in different directions, and you're taking care of multiple patients who have multiple different providers. So there's a lot of high level thinking in nursing that you have to manage, not just the care of the individual. And that means like their meds, their treatments, wound care. A lot of time you're spending tracking down, um, you know, imaging, getting orders for new medications because all of a sudden you have a headache and you don't have any pain meds. And now I have to call the provider and say, hey, so and so has, this headache, blah, blah, blah. Um, so that's a whole job in itself.
So let's say a doctor like does something and it's like malpractice. They cause like a patient a lot of harm. If you as a nurse didn't try to stop them, didn't say, "Hey, doctor, this isn't the right medicine," or like, suppose the nurse doesn't do anything right, is the nurse responsible also is only on the doctor?
Nurses are getting sued a lot more for these kind of things. We see it a lot with like medications. There's been a couple big news stories in the last couple years about nurses giving wrong medications and things. Um, and so, especially with medications, as a nurse, you're administering the medication. And so, we have these rights of medication administration to make sure that it's the right patient, right time, that the med's not expired, so on and so forth. And when a med gets ordered, the provider orders it. They're doing their checks, making sure no, medication reactions based on the other medications, based on your condition, and allergies and all that kind of stuff. And they order it. Then pharmacy reviews it, and they're also checking for those same things. And then the nurse has to have a level of awareness of the medications that they are administering, and also thinking of those same kind of things. And then when they're actually administering the medication, making sure that it's the right medication that was ordered, the right patient, so on and so forth. Um, and so, as the person administering, a lot of times you get put on lawsuits if it for malpractice, or medication error. Things like surgery and stuff, it's a little more, challenging, but yeah, when somebody sues somebody, they can add whoever, and, we are documenting, care of that person, so a lot of times the nurse's name is coming up a lot because we're, documenting frequently because 'cause we're at the bedside with the patient. Um, it's there's been a lot of, there's like national patient safety goals, um, that, they create each year. And a lot of those, some of those are like about surgery, making sure, there's been certain checks and balances that have kind of been adopted for like surgical procedures that you do a timeout. And so before you actually like everybody's in the OR or ready for the procedure. They say timeout and they have a checklist and making sure that it's the right body part and like everybody knows who this patient is, which seems silly, but because surgeries and different things have happened on the wrong limb, stuff has gotten, surgical instruments have gotten left in.
Yeah.
So yes, nurses can definitely be sued for that, but it's also this kind of hard thing because if you're a nurse and you're in the OR or whatever, and you say, "Hey, doc, that's not right," and they say, "Blah blah blah, I'm going to do it anyway," and there is this hierarchy in healthcare, um, that a lot of times nurses feel intimidated that they're gonna get fired, and, there's lots of different dynamics and different, instances, whether you work directly for that physician or not, or provider, that you may feel like you may not have a job if you speak up. Um, so, yeah, it's a hard thing, but, yeah, nurses are definitely getting named in lawsuits for sure.
So here's one for you.